Abby, good morning. Out of the 11 million women in the U.S. who are on the pill, more than half take it for reasons other than preventing pregnancy. While it's often prescribed as a quick fix solution to many women's health conditions, taking it can also cause more serious, even dangerous health consequences. Now one doctor is speaking out about life after birth control. It's a story becoming more common among women.
When I came off, I developed cystic acne for the first time in my life. I lost my period, which my period had been like clockwork prior to beginning birth control. And I felt really lost and confused, and I thought I was the only one.
Dr. Jolene Brighten spent 10 years on the birth control pill, but says she had no idea what it was doing to her body.
All I knew is that it was helping me not get pregnant, and that was my #1 goal.
So she started digging deeper and learned many of her patients had similar stories. She talks about the experience in her book, Beyond the Pill.
When you start your period, it can take a good decade for your brain and your ovaries to really figure out their dance.
That process, she says, gets interrupted when women start taking the pill in their teens, putting them at greater risk for depression, even suicide.
That may be why some women come off of birth control in their 40s and they feel like they're going through teenage hormones all over again, with mood swings and irritability, having acne and oily skin. And for some women, that can be the triggering of the onset of hair loss.
Dr. Brighten says post-birth control syndrome can occur 4 to 6 months after stopping birth control. For some women, symptoms can include digestive issues, brain fog, or headaches.
Long-term menstrual suppression via hormonal birth control is the longest and largest uncontrolled medical experiment we've ever seen, because we just don't have the data to answer all of the questions that women have right now.
But research also shows hormonal birth control can have positive side effects. OBGYN Dr. Paige Johnson says not only is it safe, it can be helpful.
And so we know that they actually decrease the risk of ovarian cancer by almost half. Breast cancer is one that there is a slight increased risk associated with it, but then we also decrease the risk of endometrial cancer by a significant amount as well.
While millions take hormonal birth control without problems, Dr. Brighten wants to make it clear it's not a bad thing, but she does want other women to get all the information so they can decide what's best for their bodies.
We do not have enough education happening in women's medicine and getting into the hands of women.
The most important thing you can do when deciding what's best for your body is talk to your doctor. Also, know your family history when weighing your options. We have more information on the risks right now on the WBIR app. Abby and Russell.